A very common question we get here in the comments is about male intimate grooming. What precautions should be taken, and what's the best way to do it? Stick with me until the end of this video and clear up this frequently asked question. Hello everyone, I'm Laura, and welcome back to the Men's Health channel. More and more men are turning to body hair removal, whether for aesthetic reasons or to make local hygiene easier. Although, to be honest, that's not really necessary. Just trimming the hair in the genital area is usually enough to ensure proper hygiene. However, the fact is that male hair removal can lead to some complications, even if mild ones, that differ from female hair removal. That's because the skin and anatomy of the male and female genital regions are entirely different. First, men sweat up to 25% more than women. Second, blood flow in the male genital area is up to 50% higher than in the female genital area. The pH of male genitals is also more acidic. In addition, the hair in the male genital region tends to be coarser, and the skin is rougher. Because of all these factors, female hair removal is generally better tolerated, more feasible, and easier to perform than male hair removal. Therefore, certain precautions need to be observed when it comes to removing hair from the male genital area. Now, just for clarification, we often use the term hair removal, but there is a technical difference between depilation and epilation. Epilation refers to the removal of the hair follicle from its root or base. It's a deeper procedure and includes methods such as tweezing, laser treatment, and waxing. Depilation, on the other hand, refers to cutting the hair at the skin's surface without removing it from the root. These methods tend to be less painful and include depilatory creams, razors, or shaving blades. But what are the main risks and complications of male hair removal? As I've mentioned, the genital area is warm and moist, a perfect environment for the proliferation of pathogens, germs, and bacteria. Men also have their own microbiota that naturally lives on the skin of the genital region. Any procedure that causes a lesion, scrape, or abrasion in the area can allow these germs to multiply or penetrate deeper layers of the skin. This can happen during or after a hair removal session. Some of the most common complications we see include superficial and deep folliculitis, which are usually self-limiting inflammations of the hair follicle, hidradenitis, which is the blockage of the sebaceous gland near the follicle, leading to an accumulation of secretions, a more painful condition, abscesses, which can be deeper and sometimes require drainage, cellulitis, which is inflammation of the skin in the area and may require antibiotic treatment and local care, and finally, more. Severe conditions such as Fournier's gangrene. This is, fortunately, a very rare but extremely serious and fast-progressing condition. Fournier's gangrene, or necrotizing fasciitis, usually begins as a superficial skin inflammation in the genital region and rapidly spreads to deeper tissue layers, severely affecting the perineal area and leading to abscess formation. It's a medical emergency that demands immediate attention and broad-spectrum antibiotics to combat the infection. While this is an extreme case, it is, unfortunately, a possible complication of poorly performed genital hair removal. As I mentioned, most complications are not serious. But how can hair removal be done in the safest, most appropriate way? What is the recommended approach? The best method is to remove genital hair in a way that minimizes skin irritation and does not compromise the skin's protective barrier. To achieve this, men can use electric trimmers. Trimmers cut the hair without directly damaging the skin. They are less invasive, painless, and can be used weekly or on alternate days. For example, a common question patients often ask is whether there are any absolute contraindications to using laser or undergoing more invasive hair removal procedures. The truth is, each case must be evaluated individually and should include a physical examination. For example, patients with genital warts or lesions should avoid these procedures, as the lesions may spread. Immunocompromised patients, such as those with diabetes or chronic diseases that weaken the immune system, must also take extra care. The genital region can become a site of infection, and in some cases, as mentioned earlier, complications can become quite serious. And since we're already discussing men's intimate health, there's an important complimentary video you can watch right now. It introduces a simple natural remedy that takes just 7 seconds and is helping thousands of men regain energy, desire, and firmness safely without medications, side effects, or the need to change your daily routine. It's a quick and straightforward video that could make a huge difference in your confidence and overall well-being. Just point your phone's camera at the QR code on the screen or click the link I've pinned in the comments below. If you found the content in this video helpful or think it might help someone else, share it. Pass the information along. And don't forget to subscribe to the channel and turn on notifications so you don't miss any of our weekly content. Take care and see you next time.